Max, a 7-year-old primary school student from Chicago, faces a difficulty to adjust at home and at school. At home, he is unable to enjoy his meals. He gets into fights with his siblings. He is moody, fidgety, and is very sad. Whereas in school, Max is not able to concentrate well. He is lost in his own dreams. He is finding it difficult to get along with his peers, and he is able to score well academically. Well, Max is one of the millions of children all across the globe who are suffering from a neurological disorder called as ADHD, that is Attention Deficit Hyperactivity Disorder. You guys might be wondering what exactly ADHD is. Well, ADHD is one of the most common neurodevelopmental disorders of childhood that are usually diagnosed first during childhood and last into adulthood, and in some cases, it is developed during adulthood. Moving further, as in the case study of Max, we saw that his symptoms were being moody, fidgety, unable to concentrate. Similarly, millions of children who suffer from ADHD suffer from problems like daydreaming, forgetting things, squirming or fidgeting, talking too much, making careless mistakes, having a hard time resisting temptation, have trouble taking turns, and have difficulty in getting along with others. On the other hand, an adult with ADHD might fail to give close attention to details. They have difficulty in sustaining attention, poor listening skills, unorganized, struggling through instructions, avoiding tasks requiring sustained mental effort, losing things, getting distracted easily, and is forgetful in daily activities. There are predominantly three types of ADHD. The first type of ADHD is predominantly inattentive ADHD, which shows symptoms like being distracted easily, being unorganized, and poor listening skills. The second type of ADHD is predominantly hyperactive ADHD, which includes symptoms like difficulty in sitting still, rushing through tasks, and making rash decisions. The third kind of ADHD is predominantly inattentive hyperactive impulsive ADHD, which shows the signs of both the kinds of ADHD. That is a combination of both the kinds of ADHD. There are majorly 6 causes of ADHD. First, brain injury. Second, premature delivery. Third, genetic factors like presence of ADHD in families. Fourth, smoking and drinking during pregnancy. Fifth, environmental factors like pollution, etc. And sixth, low birth weight. These are the major causes that have spread ADHD on a global level to millions of children and adults. A worldwide stats conducted by experts showed that 2.2% of the population of children and adolescents aging less than 18 suffer from ADHD. Whereas, on the other hand, adults aging from the age of 18 to 44 from countries in Asia, Europe, the Americas, and the Middle East contribute to 2.8% of the ADHD population. In India, a study was conducted by experts. It showed that 67.7% of the cases are male and 33.3% of the ADHD cases are of females. If we go deeper, 44% of the cases, as you can see in the pie chart, 44% of the cases are predominantly inattentive type. 43% are predominantly hyperactive type. And 13% are of the combined type. A survey conducted in primary schools showed that ADHD has been spread to 11.33% of the school-going children. As you can see in the numerical table down here, age group of 9, students of age group of 9 contributed to the highest population of ADHD, that is 26.4%. It is very important for the ADHD patients to manage their symptoms in daily life and also get a proper diagnosed treatment for it. There are 4 healthy habits that help us manage the symptoms of ADHD in real life. First, healthy eating habits, like that is following a balanced diet. Second, daily physical activity, that is jogging, running, yoga, Pilates, gymming, etc. Third, limiting screen time on gadgets like mobile phones and television. And fourth, a sufficient sleep, that is a sleep of 8 hours. Moving further, there are predominantly 2 types of treatments that are majorly available for ADHD all across the globe. The first kind is the behavior therapy, which includes training for parents as well. And second are medications. The first, that is behavior therapy, is a treatment option that helps in reducing these kind of aggressive behaviors. Behavior therapy helps to strengthen positive behaviors and eliminate the unwanted behavior or problems. Behavior therapy for ADHD can include, first, parent training in behavior management, which is very important for parents to understand and support their children. Second is behavior therapy with children. And third is behavioral interventions where they're being told their mistakes in a positive way that helps them improve and grow their mistakes. These are the following tips that are available for parents. The first is providing a positive attention, being positive with your kids and developing a positive attitude in them. Second is giving essential and effective instructions. Third is praising their child's efforts on whatever task they do, even the smallest of tasks. Fourth, establishing rewards on whatever they have done. And fifth, giving consistent consequences on whatever they have done wrong in a positive manner. In adults, ADHD can be managed using medications as well. As you can see, there are 2 kinds of medications. The 2 kinds of medications are first, stimulants, second, non-stimulants. Stimulants are the best known and most widely used ADHD medications. And non-stimulants can work and last up to 22 hours. ADHD in adults can be treated using medications, psychotherapy, education or training, or a combination of treatments. It is very important for adults to get this treated and also very important for the parents to get their kids treated. We need to make this world a better place to live in. We need to make this world a healthier place to live in. If your child is suffering from ADHD or you yourself are suffering from ADHD, do not feel hesitant to talk it out with someone. Consult professional help. Take guidance from therapists. Take guidance from your friends. Just take help, ask for help. Even for children who are suffering from this problem, we need to support them. We need to be more calm and kinder to them so they could battle this addiction, this bad disorder, and we can make this world a better place to live in. Thank you so much.